Welcome back to the Jayne Carroll Show. This is Aaron Stevens. We have a special guest joining us today. We've got Steve Buckstein, senior political analyst over at the Cascade Policy Institute. You can get there at cascadepolicy.org. How are you doing today, Steve?
I'm doing good, Aaron. How are you?
I'm doing really well. I've been excited to listen to your interview here. I got some questions for you and stuff because, boy,
Sure.
that crazy Oregon legislature's been hard at work trying to sneak a few past us. Now they don't get much by you guys, and I've been reading your media write up about what's going on. Get our listeners up to speed as to your reflection on what they've been doing down there.
Well, the big thing I wrote about yesterday is that they passed a bill to increase taxes on healthcare, hospitals, and insurance policy premiums to the tune of about $550 million.
Yeah.
And part of it is that they needed the money supposedly to balance the state budget. They have record revenue this year, but that wasn't enough. They have more than record spending they want to do, so they needed money. But they also needed matching money for the federal government to continue what's called the Medicaid expansion program to have basically government-funded health care for a larger group of people in Oregon. So they combined those in this bill, and three legislators are referring part of those taxes to the ballot so that we, the voters of Oregon, will have a chance to say what we think about it. And so it's the portion that says that insurance companies can tack on they will be taxed 1.5% of the premiums that we pay to insurance companies, but the insurance company can just pass it on to us in the bill. So if your bill is $100, you'd pay $101.50.
Yeah, no, it doesn't sound like much, but over all the different times we go to the doctor and all the millions of people and everything else, we're talking about a bunch of money.
Well, that's all the premiums. Yeah, if your premium is $500 a month, that's $7.50 they've just tacked on to your insurance premium on top of all the other increases in your insurance premiums.
Yeah, and so it's like death by a thousand cuts here because we ding you here, ding you there, and ding you everywhere, and
right.
Like you said, ultimately, there's a main point here, which is they have record revenues. They can't spend that money properly. We don't get good roads. We don't get good health care. We have very poor government in Oregon. We've seen what's going on with TriMet and everything else, and yet they think that they need to confiscate more of your money. This is just their mindset because you obviously are such a ding dong. You don't know how to spend your healthcare dollars or anything else. They're way smarter than you, and they just need to confiscate your record revenue money and spend it the way they would like to.
That's right. And as the Oregonian editorialized, it wasn't just that they wanted to do this. When they found out that somebody was going to refer part or all of these new taxes to the ballot, they created a special bill or stuffed what they call it, another bill to make it harder for Oregonians to vote that we wanted to repeal these taxes. They moved the election up. It normally would be next November 2018. They moved it to January, and they gave themselves the power basically to write the ballot title and the explanation. Normally it would be a more objective author in like the Attorney General's office, and there'd be more room for citizen input. But the legislators said, oh, no, we're going to do it our way. Write these statements that voters are going to read so we can skew it the way we want to, in effect.
Well, and it's because whenever not whenever, but oftentimes, at the ballot box, Oregonians do the right things on some of these statewide measures on taxes, and we're able to defeat some of these ridiculous things when people are able to look at the math and say, hey, wait a minute here, this doesn't smell right, and we would probably prevail in this, but they're trying to throw up these obstacles. But doing the due diligence that they do over their Cascade Policy group, and they can go to cascadepolicy.org. Tell our listeners how they can help get this petition going, so we can fight these guys our way.
Sure. The way to ensure that this will be on the ballot so people can vote on it is go to stophealthcaretaxes.com. It's stophealthcaretaxes.com, and you can download a single petition sheet so that you as an individual can sign it, or you can contact the organizers and get sheets that have like 10 signatures or 5 or 10 signatures, and then you can go out and collect signatures. They need about 59,000 signatures by early October to make sure that this will appear on the ballot.
Well, and we need to start early, and then of course we need to get more than 59,000 as well.
Much more. That has to be 59,000 valid signatures.
Right, man.
So they're going to need a comfortable cushion above that, and they've only got 3 months to do it from last Friday, which is the way the law reads.
Yeah.
So it's a short period of time, and if they do collect those signatures and they're verified, then the taxes don't go into effect until it's voted on.
Yeah. So again, stophealthcaretaxes.com. And I want to make sure people can also go to cascadepolicy.org. You're right.
That's our organization. You can read about this and see some links to other information about this particular issue there, as well as everything else that we do here at Cascade.
Yeah, because this is a biggie, and they always have these special sessions that aren't so special, and just to try to get one by us, and they always do the stuff in May as well, and I'm just so glad that you guys do this.
Well, this is even worse. I mean, there are regularly scheduled elections in May and November,
right?
So it doesn't cost much to add a measure like this to the ballot. But they've created a special election. I think it's January 23rd, and that's going to cost over $3 million. Taxpayer money, because it'll be a special election that wouldn't exist otherwise.
Yeah, that wouldn't help out with anybody's premiums or health care costs. An extra $3 million, and this is just frustrating as an Oregonian, and I did the show yesterday for the Conservative Council, and it just seems like 90% of the stuff they do from the left, it's almost like it's unbelievable what we're fighting, and I'm just so glad that, you're out there to highlight these things, because most folks just, they want to go, to the kids' soccer game or find out what's for dinner tonight or go wash the car, and they're not tuned into a lot of this stuff because a lot of it's, it's nauseating. But, I'm just glad that we have you guys to say, hey, look, we kind of sifted through some of this junk, and this one here's a biggie. This is one that you need to tune into, that you need to wrap your head and mind in hopefully your ink pen and get a petition going here and fight them.
Right. That's citizens in Oregon have the right to petition their government and the right to refer anything the legislature does to the ballot. And so this is your chance. If you don't think they should be making health insurance more expensive, this is your chance to say so.
Yeah, they do that. They're like, oh, we want cheaper health insurance, but then they the same thing. They well, we would like to have better transportation costs, but of course they want to tax all that, and the list goes on and on with these guys. Yeah,
they think government and taxes are the answer to everything, and from our perspective anyway, those are often the problem itself.
Yeah, where the flea.
Too much government and too many taxes.
It seems like the flea is bigger than the dog oftentimes.
Yeah.
So real quick, I just want to make sure that people realize some stuff about what you guys do. So you're 25 years of freedom, and like I said, there's a lot of good work that you guys do, and I want to make sure that people, they do. They oftentimes need to go to your guys' website, help you guys out, maybe do some donating or some other things that maybe they can help out with you guys. Let our listeners know how they can help with the good work that you guys do.
Well, again, our website is cascadepolicy.org, and you can see virtually everything we do there. We are a nonprofit public policy think tank, so we depend on voluntary donations from individuals and companies and foundations. It's tax deductible. We don't take any government money, so the government can't buy us to support the programs that they want us to support. We make our own decisions, and our mission is to promote policies that improve personal responsibility, individual liberty, and economic opportunity in Oregon. So if your listeners like those ideas, and check out our website and promote the concepts there or reports there, and if they'd like to make a donation, that's always appreciated.
Well, and I look a lot of times at donating to different things, and Cascade Policy Group, there's a lot of things I'm cautious about, but this is not one of them. I've met with you guys. I've met you several times, Steve, and I know the good work that you guys do, and I just it's appreciated, and our listeners need to go there. All right, CascadePolicy.org. Thank you for joining the show, Steve. This is Aaron Stevens, and we're going to get you on the other side, get you up to speed on tons of stuff. Beautiful day here in Hillsboro, Oregon. This is Aaron Stevens, Jayne Carroll Show.